Hey, everybody. I know several of you, so it's good to see you again, and others. It's nice to meet you and hope to see you in person soon when COVID is in the rearview mirror. So I have two screens up, so if you see me look to my right, I'm looking ahead to prepare what I say next. Yeah, thanks for tuning in today. I love talking about Annandale Village. Annandale Village and I were born the same year, 1969. So it's always easy for me to remember. So we're this November, Annandale will be 52 years old. We were founded by a couple, a gastroenterologist and his wife, who had a daughter with a developmental disability. Very typical story in that regard. It was in the late 60s that they were saying, wait, what are we going to do? That was well before federal legislation that provided services for folks, and they came up with this concept, and they'd seen other programs in Europe that they I think it was the Canfield model that they saw that they liked, and then came up with something similar here. Their business model was that they wanted it to be affordable to families. I think they have since passed away. Their daughter has since passed away. And it's become very expensive to provide the care that we provide. So I think they would struggle today seeing how much it does cost, but we still operate with the same model. They had wanted it to be affordable, and how they hoped it would be was by charging the families about 80% of what it costs to care for their loved one. 75 to 80%. And then we go to the philanthropic community for the rest. And today, that is exactly our model. Initially, they did not want us to be, supposedly Dr. Berry used to say frequently, in bed with the government. So he wanted us to be more of a private pay model. But when we made a decision many years ago to provide a full continuum all the way through skilled nursing care, we really had no choice but to then enter into nursing home Medicaid and nursing home Medicare. And then later, we also decided to do a little bit of waiver. So we have a day program that takes the Medicaid waiver. But most of our revenue is private pay. It was private pay fee for service revenue. So we're serving usually about 190 people in our programs. So that would include our campus, throughout our whole campus, that continuum. We have 3 licenses. The original license, when license first came to Georgia, personal care home, which is licensed for 102 beds. We usually run a census of about 85 folks in that area. That's cottages, apartments. I'll get into that a little bit later. And then as people's needs increase, we have 2 assisted living buildings, one that is set up for memory care. And then as their needs increase, again, they can move into our skilled nursing facility. So between those programs, as well as a Medicaid waiver day program, as well as a private pay day program, and prior to COVID, respite services, and how we'll count someone in that census number for respite as if they've used respite within the last 12 months. That's where you get to that 190 or so number. We have about 26 states that are represented, 2 countries. Several of our folks at the time of creating this information sheet, which was prior to COVID, about 85 of our folks were connected to vocational opportunities, either through contracts on campus or going out and working in the community. We, several years ago, coming out of our last strategic plan, created this whole new skills-based curriculum where now individuals can take a class and earn and learn specific skills that will last like a typical school semester. And we've graduated 50 folks. Once again, unfortunately, prior to COVID. Our breakdown is usually about half and half between men and women. I see that actually changing going into the future. I think we're going to see more men, with more men having autism. Most of the folks we serve have developmental disabilities, specifically intellectual disabilities, with about 10 to 12% with acquired brain injury. Our assisted living and skilled nursing facilities are almost always at capacity. If they're not at capacity, it's by our choice. So the assisted living is 32 beds with an additional 4 beds of observation. So if someone's in the personal care home and let's say they have outpatient surgery that you or I would have no issue with, they may go to our assisted living and live in one of the observation rooms for a couple nights just to be observed, where they'll have a higher level of supervision. But assisted living is, like I said, almost full. The skilled nursing facility is 32 beds. We try to keep a bed or 2 open for rehab. Should somebody need surgery that then requires inpatient rehab, or they have a qualifying hospital stay, but very often that's difficult to do. Right now, we do have 1 open bed in the nursing home that we are purposely keeping open. So the need for that assisted living level of care and the need for skilled nursing care is huge. And as you saw a couple years ago, we celebrated 50 years. This is more for some of our local presentations. This is where folks who are looking to use waiver services for us for our day programs, these are the local counties here in which they can use it. It's our region. This is some of our exclusionary criteria, or is our exclusionary criteria. We try to steer away from physical aggression. We don't feel well equipped to manage that, or self-harm, suicidal, homicidal behavior, history of fire setting, addiction issues, people with incarceration history. That we do have several folks who have received inpatient treatment for psychiatric services, so that one is not always true. And then the state of Georgia actually requires that we do a sex offender screening for everyone, which we do, and do not serve those folks. Now, it is important to note that I think any one of us who serves this population knows that this isn't always perfect. So you could admit someone, they could live here 3 or 4 years and then one day become aggressive. We don't turn around and discharge somebody. We will work with that person. So someone who's in our program already, we will devote tons of resources to keep them in the program and hopefully resolve those issues, which we often successfully do. If the aggression gets worse and worse and worse, then at some point we will have to discharge. I already talked about that we are mostly a private pay organization. We do hit up the philanthropic community every day, which covers about 20% of our budget. As I mentioned earlier, we will accept Medicaid for the nursing home, we'll accept Medicare in the nursing home, and when waiver funds are used solely for day services. Currently, someone could.
Please call 5495. Stephanie, 5495, please.
Somebody could come into our program, private pay, use the waiver for the day services. We'll subtract whatever we get from the waiver that month from their overall fee, and then the family will pay the difference. These are some cute pictures of our both our private pay and our day program. Our private pay and our Medicaid waiver day program. So the Medicaid waiver program, as many of you know, they are looking, this is a community access group. So they're looking for these folks to be in the community outside of Annandale every day or most of the days of the week. So we are constantly running buses to activities in the community. And up until COVID, that went well. We closed the program for a while. Throughout COVID, we've reopened the program. We do keep it now segregated from the rest of the campus, and probably soon we'll start to integrate the two again. We are very, very fortunate and have an incredible relationship with Suwanee Police Department. I worked at 2 other facilities prior to Annandale. I've been at Annandale 16 and a half years, but I worked at a local psychiatric hospital and a residential treatment center for children and adolescents on the other side of Atlanta, where we had terrible relationships with our police department. So City of Suwanee, which is a bedroom community of Atlanta, loves us, embraces us, and involves us in everything. We are considered a neighborhood for their neighborhood watch program. So we have a police officer assigned to us. When he works the overnight shifts, he just parks on Annandale's campus. The folks that live in Annandale refer to themselves as villagers. We refer to them as villagers as well. And so the villagers all know many of the Suwanee police departments. And some of our folks with brain injury have a tendency to wander. We're not a locked campus, so there are occasions when someone may leave the campus, and Suwanee police will, there's a walking trail right behind us, which one of our guys often ends up on, and they will pick him up and bring him back uneventfully, which is very nice. I mentioned respite care several years ago. We offered respite care for folks that were just considering our services, not realizing what that would grow into. Now it is, well, I keep saying this caveat of prior to COVID, but prior to COVID, it was a significant source of revenue. We don't even charge that much, about 150 bucks a night. And many folks have been using respite now for years. We had some families that never went on vacation, never did anything before, and now feel very comfortable calling us up, scheduling respite, and having their loved one come to us on a Friday. They pick them up the following Friday after they go out of town, and it goes really well. And even if the individual hasn't been on campus for several months or even a year, they just seem to acclimate right back in. On the campus, I mentioned we have 3 different licenses, and that personal care home license is the largest. I mentioned, I think that it's licensed for 102 beds. We usually run in a census of about 85. We don't have 102 beds set up even. But within that personal care home setting, we have a few different options. One of them is on-campus independent apartments, where you have your own studio apartment with working stove and oven. They have a choice. They can eat at the dining hall. They can make their own meals. Many of those folks work off campus. There is a picture of they were all recently renovated. I don't know if you can see my mouse, but there's a picture of the inside of one of those buildings. One of them. So in the on-campus independent apartments, there's 12 units, all studio apartments. Then we have semi-independent apartments. These are a little different setup. You have your own bedroom, and you share a kitchenette and bathroom with one other person. And once again, many of these folks are working off campus. They have a modicum of independent living skills. They do not have working stoves or ovens, but they do have microwaves and refrigerators. So they may make some meals in their house and may eat the others in the dining hall. And then once again, still on the personal care home side of the campus, you have cottages where we provide a higher level of supervision. These houses initially or traditionally were 2-to-a room. We have now moved to all but one of the houses are private bedrooms. You will have dormitory style bathrooms. And the one house that still has 2-to-a room is just a house with some folks that have lived there for many, many years. Great roommate situations. They're very happy. So there's no plan at this point to change that, but there does seem to be a desire from folks that are seeking our services to have individual rooms. So actually this house that's on there right now was 2-to-a room, and we over the years converted that to single bedrooms. I mentioned earlier, assisted living, the one that you can see there, the Keith Cato Center for Continued Care, is set up for memory care. Due to the need for assisted living, some folks have taken beds in that building who don't necessarily need memory care services. However, they needed assisted living services, so like I said, that level of care is almost always full or always at capacity. And so families are willing to pay even a little more and take the memory care spot and possibly move. The other building is directly across the street that is not memory care, but very similar to this one. You have your own private bedroom in these buildings and you share a bathroom with the person next to you. Each of these buildings has their own dining hall. So they eat their meals in their house. Back to the personal care home, I failed to mention that we have a central dining hall on campus where folks go to eat their meals. And I also didn't mention we have a 28,000 square foot program center where all the activities are run out of, including our vocational activities, art and academics, music therapy. It's probably the most popular recreation. We have an indoor pool in that building. And we are about to launch, we're in the silent phase of a capital campaign to completely renovate that building. Skilled nursing, 32 beds. We just finished our newest strategic plan, and our hope is to expand skilled nursing. So we hope to go to 64 beds. Georgia is a CON state. For those of you who are familiar with that, you know exactly what I'm talking about. For those that are not, that is certificate of need, which means the state decides how many healthcare beds there can be, and that includes hospitals and surgery centers and things like that. But additionally, it includes nursing homes. So right now, they are not allowing any applications for CONs for nursing homes. So we're going to have to find some creative strategy to expand the nursing home. People will say we have a 4-year waiting list for our nursing home. That's true and not true. What happens is when a bed opens up in the nursing home, we will take a scan, so to say, of the campus and to the best of our ability, see if anybody should need nursing care in the next 6 months or so. And we'll keep a bed open for that person. So we put priority on the folks that are living on campus. So the longest stretch we've gone without admitting someone from the outside directly to our nursing home was 4 years. And that was fairly recently. Then about a year ago, we had some openings, and so people were on our waiting list for less time than that. We recently launched a independent living program outside of the campus. It's in the city of Suwanee. We prefer that folks live in this one apartment complex. This is the fancy pool they have. And this is for folks that are requiring this tier structure here isn't 100% accurate. I think that needs a little work, but we're looking to capture folks that are needing about 10 to 15 hours of support a week, so that they definitely don't need a campus-based setting. They're also not able to live successfully on their own yet. So we launched this program. We've had a little difficulty getting it going. And interestingly, right before COVID, we had 3 admissions lined up. We have 3 people in the program, so we would have been at 6. And then we canceled those admissions. So we're now starting to talk to those folks again. And we actually had a change in leadership of that program. And throughout this most recent strategic planning process, decided to recommit to this program. One of the things we found, which was interesting, is that we're going to need to brand the program differently, that some of the folks didn't really want any association with a campus-based program. So it'll have its own name and maybe in small print, powered by Annandale Village or something like that. It does bring some families peace of mind to know that you have, a mile or 2 away, a robust campus that is staffed 24 hours a day. But like I said, there seems to be a desire to have some distinction from a campus-based program. This is still focused on the independent living program, as this was something new when we created this slide deck. well, not really new, but something we're promoting. One of the things that differentiates our program from other independent living programs, we have one of our RN who oversees our health services on campus will go out to the apartments and once a month meet with each individual to ask them how they're doing, how's it going with their meds. They have to pick up their own meds from the pharmacy down the street. How's that going? Anything they want the nurse to look at, things like that. And we like to promote a little community among them. So we'll organize some dinners and things like that. Well, prior to COVID, movies, bowling. This kind of breaks down the independent living program, what the focus would be in the first half of the year, the second half of the year when someone first comes in the program. The idea is that they wouldn't be in the program forever, like some of our other programs, that they would live independently. Jay is a guy who lived on campus for many years, worked off campus at Mitsubishi for many years, still works there, and had asked if we ever did an independent living program, could he be a part of it? And so he was our first person, and he has been incredibly successful. And in fact, last Friday, I had dinner with the guys in the program. And he was telling me that he's thinking of hiring Molly Maid to clean his apartment. So we had a really interesting discussion about Molly Maid. And he said, I'm just going to leave my key under the mat. You think that's going to be okay? And I said, well, let's talk about that. What does that mean? Are you worried about anything? And then it occurred to me, I was like, well, you have a roommate. Where's the roommate involved in this? He's like, he's not part of it. I was like, well, maybe that's the next discussion. So, but he has done incredibly well. He was working for Mitsubishi for many, many years through a staffing agency. And we'd advocated many times. And finally, Mitsubishi, this is Mitsubishi Electric, which is their heating and air division. We sort of stopped advocating for them to make him one of their employees because it had been a little frustrating. And then recently they just told him, they said, hey, we are bringing you on. You are going to be, and he is a Mitsubishi employee. You're no longer going to be through Randstad. And he is just thrilled, so happy. So that, in a nutshell, is Annandale Village.